Tired of dealing with annoying flies, fruit flies, and gnats in your home? The Zevo Flying Insect Trap is your ultimate solution. Don't wait. Check out the link in the video description now to get your Zevo Flying Insect Trap on Amazon and enjoy a bug-free home today.
Major U.S. pharmaceutical companies have been running clinical trials at hospitals affiliated with the Chinese army and may have tested drugs on prisoners in China's illegal concentration camps. A bipartisan group of lawmakers has sent a scathing letter probing the FDA for more information about decades of research from companies like Eli Lilly and Pfizer. The letter states these companies have been conducting clinical trials in China at medical centers and hospitals affiliated with the People's Liberation Army, PLA. Some of this research was conducted in the regions where the Chinese Communist Party, CCP, has been accused of setting up camps to house and commit genocide against Uyghur Muslims. This means it's possible those trials could have been conducted on unwilling participants, the letter states. The representatives said, "We believe that U.S. biopharmaceutical entities could be unintentionally profiting from the data derived from clinical trials during which the CCP forced victim patients to participate." In addition, they write that they're concerned that the data collected in these clinical trials could have been easily accessed by the Chinese Communist Party. The letter asked FDA Commissioner Dr. Robert Califf to share more information about the clinical trials conducted in China in order to respond to the representatives' concerns. These include questions about the FDA's review of Chinese military-run hospitals, how they measure data security threats, and whether they warned against testing in the Xinjiang Uyghur Autonomous Region, XUAR, where China has been accused of being engaged in genocide of the Uyghur population. The group responsible for the letter includes Representative John Molinar from Michigan, Representative Raja Krishnamurti from Illinois, Representative Anna Eshoo from California, and Representative Neil Dunn from Florida. Representative Molinar, Rep. Dunn, and Rep. Krishnamurti are members of the Select Committee on the Chinese Communist Party. Rep. Eshoo has raised concerns about American healthcare data being shared with China before. In the letter, the representatives honed in on Eli Lilly's Alzheimer's drug donanemab, known as Kisunla, and Pfizer's kidney cancer drug axitinib, known as Inlyta, Axios reported. These trials were run at military-affiliated hospitals. According to the investigation, Lilly's trials were run at the People's Liberation Army's General Hospital and Medical School and the military's Air Force Medical University. Pfizer's trial was conducted at a hospital under the People's Liberation Army's Academy of Military Sciences, according to Fierce Pharma. These kinds of trials produce sensitive and proprietary data that may be difficult to keep secure if they are run at a CCP-sponsored site, the representatives said. In addition, the quality of their data was called into question. There are also concerns with the trustworthiness of clinical trial data produced overseas from PLA institutions, the letter states. The United States needs the FDA to take on a greater role in protecting U.S. national security interests. This comes amid a greater crackdown on Chinese biotech companies. The House Select Committee will be voting on an act in September to suspend contracts with Chinese biotech firms who the committee has identified as posing a potential national security risk. On top of concerns about data, the representatives highlight potential human rights issues. A 2022 report from the United Nations accused China of detaining more than 1 million Uyghurs and other Muslim minorities, sending them to forced labor camps. Inside these camps, international officials have alleged that the CCP has sanctioned forced sterilization, rape, torture, and genocide against the Uyghurs. Most of these camps are housed in the XUAR. The letter said some research has been conducted within in the region, raising doubts that the participants took place willingly. The letter reads, "There is simply no ability for firms to conduct due diligence to ensure that clinical trials done in XUAR are voluntary." The FDA has said they will respond to the lawmakers' claims. Eli Lilly told Axios it conducts clinical trials around the world to ensure diversity in research and to increase access to its medicines. A spokesperson added the company is committed to IP protections and screens its research partners.